Hello everyone, I'm Dr. Rahul Reddy, and today I'll be telling you about some more aspects of type 1 diabetes. Type 1 diabetes children and adults take insulin multiple times in a day. They need to check their blood sugar levels often, and they should exercise on a daily basis and follow the diet as advised by a dietitian. It's important to understand about the carbohydrates present in different food and which are the food with low glycemic index and as well as high glycemic index, to understand the effect of proteins and the fats on the food that we are eating on the sugar levels rise. And it's also important to understand about what to give and what not to give during the you have low sugar levels, which is hypoglycemia. Children with type 1 diabetes are mostly on a basal bolus regimen of insulin, which is a coverage of basal insulin by using a long-acting or ultra long-acting insulin, and bolus every time they eat food for breakfast, lunch and dinner, they receive a short-acting or a rapid-acting insulin. And usually they require multiple times of blood sugar level checks in a day, such as before breakfast, before lunch, before dinner and bedtime, and some would require 2 hours after meals checks as well, and also before snacks. With this regimen, the basal bolus regimen, the sugar control tends to be very good in order to bring the blood sugar levels into the target ranges. The target ranges of blood sugar are set in different age groups at different levels, but in children, according to the ISPAT guidelines, the pre-meal sugar has to be between 70 to 130 and 2 hours post-meal should be between 90 and 180. As long as we are able to maintain the blood sugar levels in this range, usually the children will not develop any complications in future by maintaining the HbA1c in the normal target range. A lot of times what happens is children get sick due to fevers or cough, cold. On these sick days, they require even more frequent monitoring of blood sugar, that is before food and 2 hours after food, before every meal, as well as before snacks and bedtime as well. We need to ensure during these days that they do not get dehydrated, so they need to take a lot of water or liquids. And suppose their sugar levels are showing high, then they need to take salty liquids, whereas if their sugar levels are showing low, they need to take sweet liquids if they are not able to take food which is solids as usual as other days. Now, what we also need to understand is that on these sick days, they need to monitor their urine ketones or their blood ketones levels, so that if their ketones are going up, they can act on it in order to bring the sugar levels down to the normal range, as well as to hydrate themselves well in order to prevent the diabetic ketoacidosis. Now, with this, I've told you a few aspects about multiple daily injections and the basal bolus regimen, about multiple daily times blood sugar level checks, and also regarding exercise and how important diet is to maintain normal blood sugar levels in a type 1 diabetes child. I've also told you a little bit about sick day management, and I've covered these most important aspects of diabetes management during this talk. Thank you.